Okay, hey everybody. This is Kristen Craren again with Therapy Practice University, and we have Carrie here, who is a professional dog trainer, and your company name is K9 Kamp Dog Training, correct?
Yes, ma'am.
All right. So we're going to talk today about the different certifications you can get for your dog, just so that you guys have a full picture of what this industry is like, and then also how that applies to a dog that you would like to use as a therapy dog in talk therapy sessions. So, Carrie, you can start wherever you'd like to start in your explanation of this. I'm going to actually be learning some things too, because my therapy dog isn't actually a therapy dog. She's just a great dog that I have that has the behaviors necessary to bring into public and have in the office with clients. So take it away.
Okay. So as you said, I'm Carrie. We own K9 Kamp Dog Training, real near the St. Louis area. So we service St. Louis and surrounding areas here. We work with all type of dogs and all kinds of training, from people's pets who are just out of control and need clarity and need peace in their homes to therapy dogs. We don't really do service dogs, but we do. Some of the dogs we've done training for have went on to be people's personal service dogs. So just, a little bit of everything, I guess. But we do work with a lot of businesses, therapists, schools, funeral homes that want their dogs want to have dogs with them or at their facility in the public. So we do a lot of public training, if you will. So anyway, just a little bit of background about us and what we do, and why we feel led to speak on this, or able to speak on this topic. So I don't know if you have a specific question, or can we just
Yes. So this is the question that I run into a lot, because I take Piper with me to board meetings and to all sorts of like off the wall places that I can, where I can get away with it, because she's at work with me, so she's literally like,
yeah,
I can't leave her in the car,
Right.
So
Right.
therapists that I run into are like, oh my gosh, she's a therapy dog, I want a therapy dog.
Yeah.
How do I do that? And I don't have the answers, which is why I'm having you on here, because she's not a therapy dog. So what are the different designations that dogs can get? And then how do therapists make their dog a therapy dog, or is that like a thing?
So I mean, it's so gray. I mean, and every state is different as far as licenses and certifications and things. But as a general rule, in the state of Missouri, for sure, it's pretty gray. Like there's really no, like you said, Piper doesn't really have a therapy license, or you didn't go to any special therapy training, but it's your business, it's your place, or it's your work, and your work is, do you own, I don't know if you own your,
I'm in private practice, and I don't own the building, but when I came in to rent a room, essentially, I asked if it's okay if I bring my therapy dog with me.
Yeah.
And they were like, that's fine.
If it's your own business or your own building, you can do what you want with it, right? You can bring your dog in as long as you feel comfortable bringing your dog in. There's no law in Missouri that says, you have to have this certificate and your dog has to be in public or have had this much training or this, pass this test in order to go into a building with you. If it's your own building, right? Just because goes to work with you as a therapy dog doesn't mean that you can take Piper into McDonald's or Walmart or Target. So that's because that's not your building. That's not your personal. You haven't got permission. Like us, for instance, we've permission from some of the local businesses around our area to bring dogs in. They're not service dogs or therapy dogs, but they've given us permission as the business owner to, come into that business with the dogs.
So there's no designation, right? For therapy.
Right. Well, there is. So I'll go back a little bit. So there are organizations in our area and all over the states, right? So in our area, there's duo dogs, there's dogs on duty, there's APT, ATD, Association of Therapy Dogs. There are several organizations or touch therapy dogs, which is a part of duo, that will certify therapy teams. So they're not really certifying the dog, they're certifying the person and the dog as a team.
Okay.
To then, you have to either go through their training and then pass their test, or some of them will just evaluate your dog based on whatever training you've had. If you think it's ready for an evaluation, then if you pass, then you sign a contract with that organization to visit that organization's contracted facilities, if that makes sense. So
okay, so if you do this, you're getting your dog trained to do a specific duty to actually go out in the community and visit maybe a retirement home.
Right.
Or
right. But with that organization, it wouldn't give you permission to then go out into another organization. So like different facilities, like different nursing homes maybe have a contract with, for instance, the therapy program. And so if your dog and if you as a team are certified through Duo, you can then go to wherever Duo visits, and you sign a contract that says my dog will be, vaccinated, it'll be groomed, it'll be whatever it is, and you'll visit X amount of times a month or a year. I know the one that we always recommend, Dogs on Duty, they want you to commit to a once a month visit. So once they, evaluate you, certify you, and you're under their organization and you're a Dogs on Duty therapy team, then they want you to visit once a month. If they're
okay.
So it doesn't mean you can take your dog to any facility, like you would just go to those that Dogs on Duty visits. You're a Dogs on Duty therapy team, that makes sense, or a Duo therapy team, or a ADT therapy team. You're not just a therapy team that can go anywhere.
Right. Okay. So you're getting associated with an organization and going out and doing work with that organization at specific facilities.
Right.
Okay.
Right. They have different rules as far as, where they visit, when they visit, how they visit. Some of them you have to go as a team of 2 or 3 groups of people. You go to certain places. Yeah. Like I know Dogs on Duty does a lot of schools. That's why
they come. Yeah. My background is in elementary education. So I remember having the touch therapy dogs come in with the kids. So those are considered therapy dogs, right?
Correct. So therapy dog, that's a dog that brings comfort to other people.
Okay. And then there's service dogs as well, and service dogs are the animals that are helping with like activities of daily living, right?
Correct. Right. Okay. And that's that's more of a federal. There's federal rules, right? And as opposed to, service or therapy dogs being different organizations in different, states or counties or whatever. Service dogs have federal rules and, things that they have to, have to follow. Still, it's kind of gray, but yeah, those are dogs that are trained to perform a specific task for a person that can't perform that task on their own.
Right. Okay. So I think we've given everybody like a bird's eye view of the training land, or the land of training. Now say I'm a therapist, I want to bring a dog in to work with me, my building approves it, like what do I do?
Right, great question. So I mean, I feel like personally, I've never trained completely a service dog. Like I said, I've trained lots of dogs who the owners have went on to use as service dogs because that's their prerogative. They can do whatever they want with their dog, right? But I've never taken a dog and trained it as a service dog, and placed it with somebody as a service dog. So I can't speak specifically to it, but I feel like a therapy dog is so different in the sense that its main goal, its main purpose is to bring comfort to other people, versus a service dog's main goal is to be a support dog for its person. So it doesn't matter if it doesn't like other people or it doesn't like other dogs. Like it's not out in public to bring them joy. So in my opinion, it's just my opinion, I feel like it's harder to have a therapy dog because it has to be accepting of people. It has to be accepting of other dogs sometimes. It has to be okay with just lots of people in its space, especially I feel like in your case, or maybe in another therapist's case where the dog is on all day, like some of the school dogs that we have, they go to school every day, all day with their teachers. So they're hands-on working basically from 9 in the morning. So, so it's 6 hours a day, all day long.
The breed matters.
Yeah.
Breed matters.
If you're licensed with an organization, you might go do a visit once or twice a month. So that's even a different level. So if you're thinking of, bringing your dog to work, even twice a week or 3 times a week, it's a lot. So your dog has to be, in my opinion, much much better and differently trained than a service dog. It has to be able to be confident. It can't be scared, right? It can't, it can't freak out if the UPS man, which, that in a business that happens, pulls up, or watching the door. It can't react if people of, different colors and wearing hats and maybe, head coverings and things that, that they don't, they have to be exposed to all that stuff. So, it's important to have that proper training. They need to expose that dog to all kinds of things.
You just did a video about exposure yesterday.
Yes.
That's amazing. I watched the whole thing and I was like, okay, I've made a couple mistakes. I've got this new puppy.
Yeah.
I brought her to a walk yesterday for infertility, and like everyone's petting her and she's rolling over. And as I'm letting this happen, I'm thinking, I'm probably reinforcing this behavior of not attending to me and what my expectations are. But that's fine.
It's hard. I mean, it's hard. It's not easy. And I said in my video, like, I feel like if that's your end goal, especially, is to have a dog that, I guess it depends on your practice too and what your dog's doing. I mean, if your dog is just sitting in your office solely with you and people are coming in, I don't know, a few times a day, that's not as big of a deal as if you're going to be in a school and you're going to be around lots of kids. And it just really depends on the situation. Not even just kids, but just being, or a funeral home where you're just around people all the time. That I feel like those kind of dogs, and I always call those facility dogs. They're therapy dogs, but I kind of call them facility dogs.
That's a really good word.
And a facility every day, all day long, right? And so those ones I feel like for sure need to, I said, get out 3 times a week at least. It doesn't matter if they're puppies or if they're adult dogs. They need to get out at a minimum. I think that's just the minimum number of days. I would say if you can, every day they should go somewhere. Even if it's a 20-minute ride in the car just to hear different sounds.
Yes, that's what I did with Piper.
Yeah.
So what you're talking about is basically making sure that this animal is behaviorally sound, but also their personality plays a big role into it too. I know from having dogs over my years that they're just like kids. They have a certain personality. And so it sounds like training is very important. If you'd like to have a dog come into therapy sessions with you, training is important to help them develop some of these behaviors. But there isn't like a license that you get for your dog to come in and do therapy with you. This is just behaviors and really teaching them what's expected and accepting the fact that if your dog isn't the dog for therapy, like, you can't make them do it.
Oh, absolutely. That's huge. And I think I said that in my video yesterday, is I feel like, when you get your dog to the point where, okay, now I think we're ready to let people start coming into your space, and are you going into their space, and you come into a situation where your dog doesn't want anybody in their space, you have to honor that, because if you force it or push it, that's where it goes. And people do. Our instinct is just, oh, here, give my dog a treat, or people instinctively want to try to win your dog over, and that's the worst. That's the worst.
I have behind my chair here, I don't know if you can see it, I'm in my rocking chair. Piper's bed is behind my chair on purpose because that's Piper's space. And so when I have kids in the office, I tell them, this is Piper's space back there. If she goes there, that means she doesn't want to talk right now. She's feeling shy, or whatever, and we can use her behaviors to talk about feelings and like empathy and stuff like that. So,
school dog, the school and the funeral dogs that we've worked with, that's one of the big things that we stressed, was that you have to learn to read their signs, and if they go and lay down, or if you feel like you're seeing that they're getting stressed out in whatever way, then they need to have a space they can go, just like people, like we all need time to just decompress, right? And so, but there are some dogs that no matter, I feel like most dogs with the right training and the right leadership can do this. Most dogs, I'd probably say 80%, if I had to put a number on it, can do this. And you hear stories all the time of like rescue dogs that end up being these amazing therapy dogs, so it's pretty doable for most dogs, but there are a percentage of dogs that just, no matter how much training, no matter how much exposure, they're just not a therapy dog. It's just like people. Some of us are just very introverted, and it's like, you know what, we'll go out and hang out with the crowd for a few minutes and we want to go home, right? And so, just like we tell our people, like, we're raising these puppies, but they might not work out.
It's not.
They might not be therapy dogs, and so you might have to start over with a different dog. But you could certainly push them to be better, and like I said, proper exposure, training, learning how to be confident in who they are as a dog, as opposed to looking to you always for security, you know, is huge. It's huge.
Yeah,
You know?
Piper has been a work in progress. She came to me with a ton of anxiety. She couldn't even walk through a doorway because she was afraid of the threshold. And now she's 90% of the time off leash, walking with me through the building. We go eat together in Clayton. That's where my office is, and she just sits and just hangs out, and that's kind of what she does. And she's a border collie, so she needs an extensive amount of exercise. So I'm running her, you know, 9 to 12 miles a week, so that she's getting what she needs too.
Yeah.
So, but it's been really cool to have her.
Yeah, one of the things a lot of people ask me, even the ones that, you know, we train these, you know, these dogs for schools, or even our clients, you know, when they get dogs home just for a few weeks, just pets, after just a couple weeks of training, they're like, well, can it just play? I'm like, well, absolutely. Like, the dog can still be a dog. You know, they can still run around the field and, you know, do all of those things. Just when they're working or when they're at your facility, they need to, then it's different. You know, you have to just, it's a balance, right? But
Piper's not allowed to play in session.
One of the big things that I feel like I see in, you know, in our dogs and the ones that we've really properly exposed and done the training with, is that I don't see in a lot of the ones that we just get in at 4 or 5, 6 months old. It's just that confidence and comfortableness of just being a dog. You know, like they don't freak out, you know, over every noise they hear, and they're not perfect. I mean, you know, they might shy away from certain people, you know, or whatever, but they rebound, right? So they're not dogs that go run and hide in the corner and bark for 10 minutes. You know, they might shy away from somebody and take a second to come up, but it's, you know, a few seconds opposed to 5 minutes of barking in the corner. You know what I mean? So that's really the key. That's the magic, I guess, if you will. You know,
the key is exposure.
Just that they're okay. That they don't worry about the people. Don't worry about all of that. You know, I'm watching you, and if I see the signs you don't want this, I'm going to stop it. You know, and they trust in you and your leadership, and then that plays out in how they interact with people. Also, you know, all throughout their day and their life. You know, and it's hard because people want to just constantly come in their space and rub them over, and you know, you have
as a therapist, it's a great teaching tool. Like I said, you know, when people I've had grown people try to like put their arms all over Piper, and I'm just like, okay, so we're learning about boundaries today.
It's
So,
just like your child. Like, I mean, people don't see it that way, but it's like if you have a newborn baby and you're out in public, you're not going to let people, even a toddler, not even a newborn baby, but more so a baby, but you're not going to let people stroke your baby and pet your baby and come on your baby. You're going to be like, I don't think so. Or you're going to be very picky about who you let, right? Only certain family and certain friends, and it should really be the same for our dog. You know? So
if somebody wants to have a dog in their office for clients to to have as comfort for their clients, they need to hire a trainer, most likely, because I don't think your average Joe is going to know anything about training a dog. So they need, I'm not a trainer, but I would say at least like 3 months of intensive training every day.
Yeah, probably. If not like sending them away, like what we do, even just a class where they can get with somebody who's a professional dog trainer at least once a week to learn commands and proof what they've learned and one of the things that we offer that I think is beneficial if you're going to have a dog in the public is what we call an out and about class. So once you've had your training with us, you can meet up with us once a week, and it's out in public. It's at, when it's cold, we'll be at Lowe's or Home Depot or Menards or place. When it's warm, we're outside at shopping centers or parks, and so it's just a chance to get with us and other dogs and other people and practice, being out and about. So we tell all of our people who have school dogs or who have the desire to want to place their dog eventually into therapy to come to those out and abouts, because that just gives them more practice with us and it pushes them to get out. Because people they have good intention, but they don't take their dog out enough.
Oh my gosh, yes, I've seen so many people with good intentions and then they go very wrong. So is your out and about class, is that something that you can pay for separately and just join with you?
No, it's
part of your package. It really needs to be part of the package because you guys do this intensive training, and I've seen all your videos, and I'm like, this is amazing. Even your daughter does training. She's awesome. How old is she?
Awesome. She's 11.
Oh my goodness. So,
Yeah.
so
Yeah.
definitely if anybody wants to send their dog to basic behavioral training, I think they should send them to you.
Yeah.
And then like when they're out on their own, just exposure and
Yeah.
and consistency,
Yeah.
reinforcing the behaviors, positive reinforcement and consistency are the
Yeah.
best ways to have a great dog to bring in the therapy sessions. And just an add-on to that is that therapists you can call your professional liability insurance company and just basically notify them that you have this animal in the office, that their
Yeah.
shots are updated. I don't think they have a rider or anything that they need to put on for that, but just as long as you just notify the insurance company, that's enough for them, just so that they know you have this animal in here doing therapy with
Yeah.
you.
Yeah.
So,
And I would say if you get the dog, and it's a puppy for sure. I mean, it depends on the dog. If you get an 8 or 9 or 10-month-old that, is scared, and that's different. But if you get a puppy, 8, 9, 9-week-old puppy, brand new, I would take that puppy. If you know that's going to be the end goal, I would bring it. I wouldn't necessarily let it be part of the sessions right away, obviously, but have it come to the office with you. I mean, just start
yeah.
bringing it, have it sit next to crate, or, then take it out to a potty. And I mean, there's no reason why it should be at home.
I keep, we have Ziggy. Ziggy's the new terror of the household.
Yeah.
But I totally wanted to get rid of, what was that, last week? I was like, I can't do this. So I have her on a leash now next to me in therapy session, and she finally has mostly given up. So she chews on her bone or whatever. I take her out. We go back to session, I take her out. So I work from home sometimes, so that's really convenient, because if she gets out of sorts, I can put her in her room and she can hang out there. So anyway.
So, when we have a brand new puppy that we're raising for therapy, I mean, until their shots are until they've had all their series of shots, it's never a good idea to take them out in public and put them on the ground where they could get, pick up, an illness. But we still take them out at 8, 9, 10 weeks old. We just keep them in our arms. Or we keep them in the car, or we put a towel in the cart. So, I mean, going into a place like yours or a private therapy practice, that's, the chance of any kind of illness are pretty slim. So I'd feel comfortable doing something like that, but I wouldn't advocate, going into PetSmart or going into Lowe's with a brand new puppy because of all the different diseases and illnesses.
So something you've said in our conversation is treat it like you would your baby.
Yeah.
You wouldn't set your baby on the ground at 8 weeks and just drag it along.
But at the same time, you don't necessarily keep it in the house for 3 months either, because then, I mean, a baby's a little bit different because they mature slower than if you wait until your puppy's 4 months old and had all of its vaccines, I feel like you missed a really important window of exposure right exposure. I mean, if you're going to do it wrong, don't do it. But just getting them out and taking them places, I feel like is really important. We'll put the puppy in the van and take it with us, and not even take it out. Just go ride in the van for the day with the other dogs when they go out training. And they get to just experience all those sounds and noises out. Not put it in a safe way, in a safe way. And then he wants to take it out and carry it in the store and just carry it around for 5 minutes and go put it back, So, and then, just not letting anybody pet it and just getting it used to just being out. So I would say, for sure, those are things that you should be doing. And if you have an older dog who's not, you can control, same thing, bring it too. Just do the right kind of exposure.
So, if anybody is thinking about getting a dog to use in therapy sessions and they want you to train it, how do they get a hold of you?
They can call us. We're on the web, so K9KampDogTraining.com. We've got a website. We also have a Facebook page. You can find us on Facebook at K9 Kamp Dog Training, and also Instagram. So pretty much all the social media avenues you can find K9 Kamp Dog Training, or on the web.
Awesome.
Yeah.
Awesome. Well, I love seeing you on Facebook, and I love all your videos. So thank you
I appreciate it.
Making those available. And thanks for having a chat with us. I think it's going to be really helpful for a lot of people looking to train their dogs. So, all right.
I think it's a great added benefit. So, yeah.
Okay. Thanks a
all
lot.
right.